Welcome to CHSI Modular Mandatory 8HR Seminar and COVID-19 Workplace Safety and Health Orientation. House Rules. Number 1. Submit seminar requirements at safetyofficer@chsifil.net after 7 days you received the modules. Number 2. Read and study the modules at your own free time either during or after working hours. Number 3. Call or notify Safety Officer for any inquiries or clarifications at this mobile number 0997-572-1538 from 8 a.m. to 5 p.m. Number 4. Workshop forms and other documents will be emailed to you. Number 5. These modules are intended for your seminar use only. Thus, reproduction, distribution and unauthorized use without permission from CHSI management is prohibited. Modular seminar includes 1. Mandatory 8-hour safety and health seminar for workers and 2. Prevention and control of COVID-19 based on DTI and DOL interim guidelines and JMC. Requirements for 8HR seminar. There will be a short test for Module 1, 2, 5 and 6. In Module 3, you need to accomplish a risk assessment, RA. In Module 4, you need to accomplish hazard identification risk assessment and control, HIRIC. Submit accomplished safety commitment and attendance sheet. Mandatory 8-hour safety and health seminar for workers. Pursuant to Section 16B of RA 11058 and Section 3 of DO 198-18. Prepared by Fernan O. Tabbins, CHSI Safety Officer. The next 2 slides are the course/seminar outline provided by DOL and to be accomplished by the company safety officer. Module 1, Overview. Objectives. To express appreciation on occupational safety health. To recognize the importance of various data and legislation relating to OSH. This is the Philippine Health and Safety Standard or OSHS. Some called it as Yellow Book. Introduction to OSH. The possibility of accident and adverse effect to health is always present in any workplace. All work exposes workers to hazards, example, manual handling of materials, use of machines, exposure to toxic substances, contact with electricity, exposure to radiation, stress. Occupational safety and health, OSH, is defined as a state of being certain that exposure to workplace conditions will not cause adverse effects to the well-being of a worker in terms of injury and illness. Importance of OSH. 3 reasons why OSH is important to companies. According to WHO, 2010, OSH is important based on 3 arguments. Right thing to do is based on ethical principle in that the employer, while earning profit, has the moral obligation to protect employees from accidents and illnesses. Workers have the right to safe and healthful workplace. Moral. 2. The smart thing to do is based on the economic principle in that no business owner wants accidents because accidents and illnesses impose a massive cost to business. They not only lower productivity, but in the worst case, can even end the business. Economic. Importance of OSH. 3. It is the law, is based on the legal principle in that employers violating the provisions of the law are imposed penalties and can be issued work stoppage orders by the appropriate authorities. Legal. Moral. Morally right to safeguard worker from harm/moral duty of the company to provide best care of their employee. Economic. No or low accident decreases cost of the company/efficient safety and health management promotes productivity. Legal laws that protect safety and health of workers. The cost of accidents. OSH is a strong business case. Investing in the prevention of accidents and ill health is one of the best decisions a business organization can do because they cost time and money. The fact is, many businesses do not recognize the costs as most of them are indirect and hidden. Only a fraction of the whole cost is actually seen, like an iceberg. The costs of accidents and illnesses that are easily seen are called direct or recoverable costs, while those which are hidden are the indirect or unrecoverable costs. Indirect costs are usually many times greater than the direct costs. In fact, uninsured losses are 10 times the cost of insurance premiums according to House UK, RoSPA. The following are examples of indirect or hidden costs. Lost time. Sick pay. Damage of products. repairs of equipment, extra wages, production delays, investigation time, fines, lost contracts, legal costs. OSH statistics. According to the International Labour Organization, ILO, during the World Safety Day celebration in 2019, average of 7,500 die every day due to work-related accidents. 160 million incidents of occupational illness every year. 270 million work-related accidents every year. The biggest killer in the workplace is cancer, causing roughly 640,000 or 32% of deaths, followed by circulatory diseases at 23%, then accidents at 19% and communicable diseases at 17%. Asbestos alone takes about 100,000 lives annually, ILO. Situationer using company data. CHSI provides PPE. Safe workplace. Safety officers. Health personnel. Facilities. Work procedures, this is required. RA/HERIC/JA, this is required based on work procedures. Compliances to DOL, ongoing. CHSI has no casualty record on file, incident/accident. CHSI OSH training of personnel ongoing as well as safety induction and mandatory 8 hours OSH seminar. Salient features of OSH legislations. OSH is too important that the government has enacted a law to penalize violations of the occupational safety and health standards and other requirements. Legal basis of OSH. PD 422 to 1974, the Labor Code of the Philippines. OSH Standards, 1979, as amended 1989. RA 11058, an act strengthening compliance with occupational safety and health standards and providing penalties for violations enacted January 25, 2019, and its implementing rules and regulations, Do 198-18. Salient features of OSH legislations. Based on this organizational chart, it is the DOL who regulates and implement policy formulated by BWC, while OSHC plays as a training provider for safety and health training, and ECC for workers' compensation under Employers' Compensation Program, ECP. For more details ECP, you may ask your HR personnel. Salient features of OSH legislations. The Department of Labor and Employment, DOL, has issued orders to guide employers or establishments to address potential hazards to health of workers. Relevant issuances to control of biological hazards are the following. Salient features of OSH legislations. Slides 20 and 21 means that every establishment or company should establish policy, procedures, or programs on how to prevent, treat, rehabilitate, control and educate workers from the exposure to the different biological hazards. The OSH Standards. OSH Standards in the Philippines is a set of mandatory rules on occupational safety and health which codifies all safety orders issued prior to its promulgation. It is commonly called the Yellow Book example of rules from OSHS. Rule 1000, General Provisions, Duties of Employers and Employees as per RA 11058/Do 198-18. Rule 1020, Registration of Establishment valid for lifetime. Rule 1030, Training and Accreditation of OSH Personnel. Rule 1040, Health and Safety Committee. Rule 1050, Notification and Keeping Records of Accidents and/or Illnesses. Rule 1960, Occupational Health Services. Rule 1070, Occupational Health and Environmental Control. Rule 1080, Personal Protective Equipment and Devices. The next two slides refers to the legal basis of our Safety and Health Committee, which was taken from Do 198-18 of RA 11058, known as an act strengthening compliance with occupational safety and health standards and providing penalties for violations thereof. The OSH Policies and Programs. Some of OSH policy. Drug-free workplace policy. HIV/AIDS workplace policy. Tuberculosis prevention and control workplace policy. Hepatitis B workplace policy. Environmental policy. Mental health policy. OSH program. Safety and health program. Prevention and control of COVID-19 program. General concepts of OSH. The system theory of accident causation proposes that work is a system composed of a group of regularly interacting and interrelated components such as people. A hazard is any source of potential damage, harm, or adverse health effects on something or someone. OSH. Harm is referred to as physical injury or damage to health. Multiple causation theory of accident, arguing that a single accident has multiple causes. The theory considers unsafe acts and unsafe conditions together with human errors as the immediate causes of accidents. And behind those immediate causes, there is system failure and personal beliefs as root causes according to Hartshorne. Please see below model. Accident causation theories. In the study of causes or the root causes of accident conducted by Herbert William Heinrich, according to him, 98% of workplace accidents are preventable and only 2% are non-preventable. Of the 98% preventable accidents, 88% is due to unsafe/unhealthy acts or man failure and 10% is due to unsafe/unhealthy conditions. This study explains the rationale for focusing interventions on changing the behaviors and attitudes of workers and management towards safety and health. 98% workplace accident are preventable. -88% unsafe acts/man's failure. -10% unsafe condition. 2% are non-preventable/act of God. Unsafe/unhealthy act, ANSI defines this as any human action that violates a commonly accepted safe work procedure or standard operating procedure. This is an act done by a worker that does not conform or departs from an established standard, rules, or policy. These often happen when a worker has improper attitudes, physical limitations, or lacks knowledge or skills. Examples of unsafe acts include horseplaying, smoking in non-smoking areas, using substandard/defective tools, non-wearing of goggles/gloves. American National Standard Institute. Unsafe/unhealthy condition, ANSI defines this as the physical or chemical property of a material, machine, or the environment which could possibly cause injury to people, damage to property, disrupt operations in a plant or office, or other forms of losses. These conditions could be guarded or prevented. Examples of unsafe conditions include slippery and wet floors, dusty work area, congested plant layout, octopus wiring, poor storage system, scattered objects, tools, and materials on the floor. Benefits of having safety and health practices. Awareness, hazard identification, hazard control, accident prevention, zero accident, loss control, save money, save lives, and moral, economic and legal aspect of the company. In other words, 1. Protect workers from injury and illness. 2. Lower injury/illness costs. 3. Reduce absenteeism and turnover. 4. Increase productivity and quality. 5. Raise employee morale. 6. Increased workers' compensation insurance costs. 7. Avoid or minimize damage to equipment or machinery. Module 1 Short exercise. You may write your answer in a bond paper with name, signature, date and job title. According to Herbert William Heinrich, why does we need to focus on changing the behaviors and attitudes of workers towards safety and health? 2. Give at least 2 unsafe acts and 2 unsafe conditions in your workplace. 3. Give 1 legal basis of OSH. Module 2, Understanding OSH. Objective: to be able to understand, learn and discuss basic concepts of OSH towards an effective OSH implementation in the workplace. Definition of terms with examples. Safety hazards: a source or situation with a potential to cause harm in terms of injury, ill health, damage to property, damage to the environment, or a combination of these. Example: refer to unsafe act/unsafe condition. Health hazards: a source or situation with a potential to cause an illness and other work-related and/or occupational diseases. Example: dust, smoke/co, vibration, noise. Chemical hazards. What is risk? Ano ang peligro? Risk, a combination of the likelihood of an occurrence of a hazardous event with specified period or in specified circumstances and the severity of injury or damage to the health of people, property, environment, or any combination of these caused by the event. Risk equals likelihood x severity, R equals LXS. Low risk, low level of danger or exposure to safety and health hazards and not likely or with low probability to result in accident, harm, or injury or illness. Medium risk, there is a moderate exposure to safety and health hazards and with probability of an accident, injury, or illness, if no preventive or control measures are in place. High risk, the presence of hazard or potential hazard within the company that may affect the safety and health of workers not only within but also persons outside the premises of the workplace. There is also a high level of exposure to safety and health hazards, and probability of a major accident resulting to disability or death or major illnesses is likely to occur if no preventive or control measure are in place.